Durasphere injectable bulking agent is composed of pyrolytic carbon-coated beads suspended in a water-based carrier gel. Durasphere is indicated for the treatment of adult women with stress urinary incontinence due to intrinsic sphincteric deficiency. This video demonstrates the technique of transurethral Durasphere injection. The objective of the procedure is to obtain closure from the bladder neck to mid-urethra by injecting Durasphere until the tissue surrounding the bladder neck collapse. Insert the primed needle into the scope and insert the scope into the urethra. At mid-urethra, choose a position that is comfortable, between 4 and 8 o'clock. Position the needle bevel toward the urethral lumen and puncture tissue at a 45-degree angle until the bevel of the needle is covered in tissue. Re-angle the scope back, parallel to the urethra. Tunnel the needle tip towards the bladder neck 1 to 2 centimeters so that the needle tip lies at the proximal urethra. Begin injecting Durasphere using consistent, moderate thumb pressure on the plunger. When the needle tip is placed in the proper tissue plane, the material flows readily, creating a tissue bulking effect. When the needle tip is not placed correctly, Durasphere injected into fibrous tissue prevents the flow of beads. The fibrous tissue acts as a sieve, allowing the carrier gel to flow without the beads. This can cause significant resistance and can result in clogging the needle. Resistance is an indicator of incorrect needle placement. Should this occur, reposition the needle into the submucosal tissue prior to continuing injection. Continue to inject Durasphere into the site until the Durasphere sac has crossed the midline of the urethra. Most sites will require more than one syringe. It may be necessary to choose an opposing site for injecting. Again, multiple syringes are injected to close the proximal half of the urethra. Continue to inject Durasphere until the tissue surrounding the bladder neck collapse. This 65-year-old female patient has residual stress incontinence after a previous pubovaginal sling procedure. The urethra is well supported. At the 4 o'clock position, the scope is angled at 45 degrees until the bevel of the needle is within the urethral wall. The scope is then angled back parallel with the urethra, and the needle is advanced 1 to 2 centimeters towards the proximal urethra. Inject Durasphere into this site until the sac has crossed the midline of the urethra. Most sites will require more than one syringe. Excellent partial closure is seen. In order to achieve more complete urethral closure, additional Durasphere material is injected at the 8 o'clock position. When it is time to leave the site, cease injecting. Wait 15 seconds and slowly remove the needle from the site. Slight extravasation of Durasphere may be observed. Our objective is achieved with excellent closure at the proximal urethra.